Hi, my name is Dr. Elissa Cohen with Pelvic Floor for Moms. I'm here talking about pelvic girdle pain today. I'll call it that, but that means even like pubic symphysis pain, SI joint pain, low back pain, glute pain, things like that. We're talking about that today and what to do about it. So I call it pelvic girdle pain because the pelvis is like this circle, right? And so anywhere along that circle, if there's dysfunction, it is connected to other parts of the circle, right? And so tension here can contribute to pain here or whatever, right? On the pelvis, there's 3 joints, so SI joint on either side, and then you have that pubic symphysis in the front. But dysfunction in these joints can also then translate up into low back pain, sometimes hip pain, things like that. So we're talking about pain in all of that pelvic region today. So in terms of how we treat that, I'm always looking at mobility before stability. So we want to make sure that the muscles connected to the pelvis are of a good resting length, so not too tight to begin with. If something's too tight and we try to strengthen it, it's probably just going to make it tighter and more painful, plausibly. And often, whether it's the chicken or the egg, whether the tightness is causing the injury or the tightness is just a result of the dysfunction that is going on, it's going to be a problem until you loosen up, and then we can stabilize after that. So I have a playlist on the mobility tools that I like to refer patients to. But often it means that we're using, like, my favorite is lacrosse ball or some sort of tool to do kind of trigger point or fascial mobility, fascial release. Whether that means a lacrosse ball, foam roller, or also there's a ball that's a little bit bigger called a alpha ball. That one's really nice too to get in some certain spots. But I'm thinking about loosening up all those muscles that cross the SI joint, so piriformis across here, glute med through the backside, even like sacrotuberous ligament down here, releasing some in there can help free up the mobility of the sacrum so that things can move better. So we can work through that on both sides, working through the glute med, kind of like where you put your hand in your pocket, some of those muscles back there. Honestly, it really doesn't matter what you're releasing as long as it is not like sharp and painful, and it's not like a nervy zinger sort of sensation. If it feels like a tight sore muscle, release it. And when you're doing muscle release, find that tight tender spot, hold it for 1 to 2 minutes until it starts to soften a little bit or become a little less painful, and then you're going to move on to your next tender spot. So releasing through the back side. Some of this stuff through the front side is not on this model, but iliacus is in the inside of the ilium. So you can lay on a ball and do some release in there. The muscles that attach to the front side of the pelvis here, so like quads and things like that, those can be really nice to release. Even adductors on the inside of the thigh, medial thigh, those are going to come up and insert into pubic bone and some of that stuff here. So that's going to be really nice to release those tissues. And then also all of those low back muscles where we're having that pain most of the time anyway. Even if it's an SI joint problem, a lot of times you're going to get tension in those low back muscles. So referring to that mobility playlist to look at how to release some of those painful and tight tissues. So we're always going to start there, because again, if you're going to try to strengthen your way out of a dysfunction, you're just going to be tightening those already tight and painful muscles, which can work sometimes because I think people do it, but more effectively I think is to get mobility first. And then you can refer to that strengthening playlist. Once we've created mobility, pain is down a little bit and you're feeling a little bit better, then we do need to stabilize, right? Especially if you're in that postpartum period or even during pregnancy, we do and want to and can strengthen and stabilize and stay strong during pregnancy. So prenatal or postpartum, we do need to think about like strength of transverse abdominis, glutes, all those muscles that attach around the pelvis. So even adductors, glutes on the back side, pelvic floor, even deep transverse abdominis is going to come across here. So we want to strengthen all those muscles that attach to the pelvis also to help stabilize and decrease pain. That being said, one of the other things that I like to talk to people about is their posture, especially during pregnancy and postpartum. There's so many changes happening in your body and your center of gravity is changing. And so with that, your posture is going to change unless you're being mindful of what you're doing. So when you're pregnant and you have more weight out here, it can be really easy to like lean back against that weight out here. And I guess that being said too, when you're holding a baby, a lot of times I see people leaning back, dumping their pelvis forward, doing weird rib cage things and ending up here, right? Which, as you can see, is going to put a lot of pressure in that low back, SI joint, sacrum, things like that. So for posture, what I'm thinking about is your body as a stack of blocks. So if I have my head, rib cage, pelvis, and then my feet and ankles, all those blocks need to stack right up to gravity so that when gravity pushes down, you have a nice stable stack of blocks. But if your head is forward and your rib cage is back and your pelvis is dumped forward, then gravity is going to push down and it's going to squish and it's going to hurt, right? So stacking those blocks up to gravity and being nice and strong and tall. And then once you get stacked up, then that's where those stabilization muscles, that transverse abdominis, core, glutes, all the things come in to help you stabilize there. Posture is a moving target, right? You're not going to be perfect all the time, especially holding babe, doing like things, baby's over here, doing something over here. I always use pain as my guide. So if I'm doing something and my back is hurting, I try to think, okay, how could I do this better? Can I stack up better? Can I use my core better? Usually that at least reduces the pain. So be mindful of your posture as best as you can. When it goes wonky again, fix it up, okay? Okay, so then I find that people have a hard time finding time for exercise during pregnancy and postpartum. Pregnancy, sometimes you just don't feel very good, whatever. Postpartum, you got a baby to take care of, and so doing a home exercise program, all that kind of stuff is just low on your totem pole, so it gets really hard to find time for even 10 minutes of PT, home exercise program kind of things. But if you can think about how you're using your stabilizing muscles throughout your day-to-day activities, you have like 16 hours of the day that you're awake and upright to gravity for the most part. The way that you're using those muscles in that time period is going to have so much more of an impact than like your 10-minute home exercise program that you maybe do 3 times a week, right? We can do that home exercise to get familiar with those muscles and find them better, but if you're just applying that to your whole day, day-to-day, as much as you can, that's going to be so much better than PT homework, right? So no shame there. Core, you're going to have on 10%. If you're just standing upright to gravity, we're going to engage that core 10%. Not squeezing it as hard as you can, but like then that's going to increase per activity, right? So if you're going to pick up your baby, maybe you're using like 30%. If you're going to pick up that car seat, maybe you're 40 or 50%. If you're doing some like exercise and like a plank, maybe your transverse abdominis and core muscles are on 80%, but you're not 80% most of your day, right? So getting up and off the couch, holding baby, standing upright with baby, car seats, bending and lifting, all those sorts of things, that's where you want to think about TA, deep core engagement. Glutes, I tend to think about like bending and lifting and picking something up from the ground again, picking up toys, going up the stairs, getting like a pot from a low shelf. Those are all things where when we push back up to standing, you can push through those glutes and find those glutes. So again, if you're not finding time for home exercise, fine, apply it to day-to-day activities. The last thing I'll say about this stuff is, we talked about posture and standing, right? But like our life doesn't happen in this neutral standing posture. So we need to learn to do this hip hinge sort of motion. Now it is safe and okay to bend your spine if you're not like lifting anything. If you're just like unloading the dishwasher, it's okay to bend your spine. But when you're painful and injured, it's not gonna feel very good for that period of time, right? So then we need to be able to find that neutral spine to be able to bend in that neutral position to perform day-to-day tasks, even like washing your face and brushing your teeth and things like that without pain. And then once you get stronger and more stable and less painful, then you can go back to like using your spine a little more freely. So I always teach people at hip hinge often with like a broomstick or something like that, but you can practice at home with those things. So like I'm using a foam roller, but it should touch your head, the middle of your back, and then your sacrum. So those should be your touch points. And now as you go to bend and hip hinge, you should keep contact in all those spots, and you should also maintain this little curve in your back. So I have this little space here, right? So that if I'm going to bend and I bend my spine, now I don't have this space. The rollers come off my sacrum, and actually my low back is touching that roller. So maintain that little space, and then you can practice your hinge there. So maybe you just do 10 of those just to get the feel for it, but then again, we're applying that to day-to-day activities. Baby off the floor, lifting car seat, unloading dishwasher, brushing your teeth, all those things. Okay, so if you have any questions on that, let me know in the comments, but hopefully that's helpful.